Good afternoon, everyone, or good evening in Florida, I guess. This is a 1-hour webinar on primarily on the treatment of endometriosis. But before doing that, it's important, in my opinion, to talk about the 4 phases of the menstrual cycle. I use treatment according to the 4 phases a lot in gynecology, nearly always. And as we will see, especially in the treatment of endometriosis. I've done that for many years and it gives very good results. And treating according to the 4 phases allows us to treat both the Ben and the Piao. What do I mean by that? For example, a woman has kidney yang deficiency, that is the Ben, the root of the condition. But she also has blood stasis and dampness, for example, which is the Piao of the condition. In normal situations, you have the dilemma of what to do. Should I treat the Ben or should I treat the Piao, or should I treat both? By giving the treatment, applying the treatment according to the 4 phases, we have a very elegant way of treating both the Piao and the Ben. In the example I just gave you, for example, we could treat kidney yang, tonify kidney yang in phase 2, resolve dampness in phase 3, and invigorate blood in phase 4. And this is just as an introduction. It will become clearer in a moment. So the theory of the 4 phases of the menstrual cycle is not a classical theory. You will not find it in the ancient Chinese gynecology books. It is a new theory, and it was elaborated primarily by Professor Xia Cheng, whom I learned from in Nanjing. He's now retired, and he's a gynecologist who has an amazing experience, especially in the treatment of infertility. And he developed the theory of the 4 phases, which is, as you will see, a very clever blend of Chinese thinking, traditional Chinese thinking, and a view of the menstrual cycle from a Western point of view. The estrogen and progesterone and follicular phase and luteal phase. And Dr. Xia's theory is very simple. He says that the menstrual cycle is the result of a tide, an ebb and flow, and actually 2 tides, one of yang and one of yin. So there is an ebb and flow of yang and an ebb and flow of yin. And as we know from the theory of yin and yang, when yang is at its maximum, yin is at its minimum, and vice versa. And specifically, that is a tide of kidney yang and kidney yin. As we will see also later on in a moment, the menstrual cycle is a tide of kidney yang and kidney yin because the kidneys are the origin of menstrual blood. The famous gynecologist of the Qing dynasty, Fu Qingju, stressed that a lot. He said menstrual blood is not blood. It's not like the blood of liver blood, the blood that nourishes the sinews, the eyes, and the tendons, etc. But it is tian gui, which derives from the kidneys, and especially from kidney yin. So let's move on and analyze the theory of the 4 phases. This diagram here illustrates what I just said, i.e. the ebb and flow of kidney yang and kidney yin. It should be stressed that these 2 lines are theoretical lines. In practice, they would not look like that, not so symmetrical. And I'll show you in a moment how they might look in practice. But in order to understand the 4 phases, it is useful to look at this diagram. And as you can see, the yang is at its maximum at the beginning of the period. On the left of this diagram, that is the beginning of the period of bleeding. So yang decreases rapidly, has its minimum and mid-cycle, and then rises again, and vice versa for yin, kidney yin. And as we know, when yang is at its minimum, yin is its maximum, and vice versa. So try to remember those numbers because we'll refer to those numbers during this lecture, phase 1, 2, 3, and 4. So phase 1 is the bleeding time, which in 80% of women is usually 5 days, but it could be 7 or it could be 3. And phase 2 is the post-menstrual phase, roughly a week from the end of bleeding. Phase 3 is mid-cycle and ovulation, also roughly a week long. And phase 4 is the premenstrual phase, also roughly a week long. Of course, we're assuming, when discussing this theory, we are assuming that the period is relatively regular. But we will see how this theory applies even if the periods are quite irregular. For example, if they come every 2 months or every 3 months, or if the cycle is shorter. You can still identify the phases, and they kind of stretch when the cycle is long, or contract when the cycle is short. So for the time being, we're assuming a relatively normal cycle of 28, 30, or 32 days. So those are the numbers we'll refer to. Phase 1 is the bleeding, phase 2 is postmenstrual, phase 3 is mid-cycle and ovulation, and phase 4 is premenstrual. Now notice something very important in this diagram. When the period starts, yang is decreasing rapidly and yin is increasing. So there is a switch from yang to yin. Yang has reached its maximum and must go down. So it's a transformation from yang to yin. If you look at the middle of this diagram, you will see that yin has reached its maximum and must go down, and yang rises. So there is a transformation from yin to yang. So those two moments are moments of transformation. And as we will see, this transformation is under the influence of the heart. The heart is not often mentioned in connection with gynecology, and we always talk about the liver. But the heart plays, in reality, quite an important role in menstruation. And this is one of them. Heart chi and heart blood need to go down to the uterus and the kidneys to connect with the kidneys to promote that transformation. So the heart has two functions. One promotes that transformation from yang to yin when the period starts, and yin to yang and mid-cycle. And it also promotes the descending of qi to the uterus for the discharge of blood with menstruation, with bleeding, and the discharge of eggs at ovulation. For example, supposing the period doesn't, 1 month the period is late, it could be due to an emotional upset having affected the heart, so that heart qi does not go down to the uterus and the period is late. Or the opposite could happen. Another type of emotional problem, for example, fear, which makes qi descend, would make heart qi descend too soon, and the period starts early. And the same for ovulation. For example, it could be that 1 month ovulation is delayed because heart qi and heart blood are not going down to the uterus to promote the discharge of eggs. So let's move on. So as I said, the times of transformation from yang to yin and yin to yang are marked by discharge and downward movement. And this is very important. When we think of the heart and kidneys in this relation, we should not think of the 5-element Sheng cycle, the one in a circle. But we should think of the 5-element diagram in the form of a cross, with the heart at the top, the kidneys at the bottom, the liver on the left, and the lungs on the right, and the earth in the center. So there's a vertical axis between heart and kidneys. They need to communicate with each other, nourish each other. The heart qi needs to go down and kidney qi needs to go up. And this is very important for a normal menstruation. Dr. Xia, if you look at this clinical note in this slide, Dr. Shah attaches great importance to the discharge of blood with menstruation, because he calls that a discharge of the old blood, stagnant blood. And he says insufficient discharge may lead to blood stasis, which is a cause of endometriosis. And that's interesting because as practitioners, we tend to attach great importance when the period is heavy, and we kind of tend to panic. We want to do everything to kind of reduce it or stop it. But we don't panic when the period is scanty. But according to Dr. Shia's theory, that is as bad as the period being heavy, because it leads to what he calls retention of menses. So taking into account the differences between the theoretical diagram and the more realistic diagram, this is an attempt to show how those two lines might look more realistically. There are two major differences. If you look at the blue line first, notice that the minimum of yin is not at the beginning of the period, but towards the end of it. So because at the end of the period, because of the bleeding, and blood is part of yin, there is a relative deficiency of blood and yin. And the stress is on the word relative. That does not mean that every woman at the end of the period has blood deficiency. It does not mean that. It simply means that at the end of the period, the blood is, relatively to other times of the cycle, is relatively lower. And by consequence of that, it also means that at the end of the period, or in the phase after the end of the bleeding, it is a good time to nourish blood and yin. So that's one difference from the theoretical diagram we've seen. The yin has its minimum towards the end of bleeding. And the second difference is a mid-cycle. If you look at the red line now, notice how the red line rises more steeply here. And that is reflected in the rise in temperature. If you look at the bottom diagram, the rise in temperature that occurs after ovulation. So, and then the yang tends to level off and then rise again in the premenstrual phase. So this diagram here reiterates what we just said. The kidney is in charge of the generation of yang and yin. Without kidneys, there would be no menstruation, because without kidney yang and kidney yin, there would be no tiangui, and the menstrual blood is tiangui. The heart, on the other hand, controls the transformation of yang to yin and yin to yang that occurs at the beginning of bleeding and at ovulation. And this diagram here compares the four phases in Western gynecology with those in Chinese gynecology, and as you can see, they coincide except for the luteal phase, which spans phases 3 and 4 in Chinese gynecology. So the menstrual phase is 1, the follicular phase, which we call post-menstrual, is 2, ovulation is in phase 3, and the luteal phase spans phases 3 and 4. And this is the diagram that I was mentioning earlier. That's how we should see the 5 elements in this context. There's that all-important communication between fire and water. Fire goes down to meet the water, and water goes up to meet fire, which is strange, because normally fire rises, naturally rises, and water descends. And that quotation at the bottom is an attempt by a Chinese doctor to explain how that might happen. He says the kidneys pertain to water. How can it ascend? Because there is genuine yang in water. And then he says the heart pertains to fire. How can it descend? Because there is genuine yin in fire. For whatever reason, that vertical axis between heart and kidneys is very important in gynecology, and actually it is important in other fields too. For example, in the mental emotional field, that vertical axis represents the communication between Shen and Je, the Shen of the heart and the Je of the kidneys. So let's look at the phases in detail. In phase 1, that's the bleeding time, and phase 1 is characterized by a strong downward flow of qi and blood. Blood is going down, the old blood is being released, and qi is moving downwards. And this phase, the activity around this phase is centered around the Xiaofu area. And this diagram here illustrates the difference between Xiaofu. The central area where the renmei is called Xiaofu, Xiao, which means small abdomen. And the two sides are called Shaofu, Shao, which means lesser abdomen. So in phase 1, the activity is centered here in the center, and qi is moving downwards. And as we will see, as we've mentioned, this downward movement is under the control of the heart. Phase 1, there is also a sharp drop of yang, and that is interesting because that is an explanation of how premenstrual symptoms disappear when the bleeding starts, because there is this rapid, sharp drop in yang. And phase 1 is under the influence of liver blood. So blood is moving downwards, the liver stores blood, and the liver also moves blood with its free flow of qi. So a good, smooth functioning of the liver in this phase is important, as well as the downward flow of heart qi. And Dr. Xia says you could interpret most menstrual symptoms in very simple terms of yin and yang. For example, if yang does not decrease at this time, the period may not start or start late. Or if yang decreases too much, then also menstruation may be early and heavy. And this slide here lists 3 herbs which have a downward movement, which make qi and blood go down. So those are herbs you would use if the period is late, and obviously you would not use if the period is normal, and especially you would not use if the period is heavy. So in phase 2 is the postmenstrual phase, and we're in the follicular phase from the Western point of view, under the influence of estrogen. Yang is decreasing and yin is increasing, which reflects the development of the follicle. And I always hesitate in making direct connections between Chinese and Western medicine, but you could say that estrogen and the follicular phase is more ruled by yin than yang. It's the yin substance. And the luteal phase and the progesterone is under the influence of yang. And in the postmenstrual phase, which starts immediately after the end of bleeding, there is a relative, not deficiency, but a relative low level of blood and yin. And as I stressed earlier, this is not a deficiency in a pathology sense, but simply means that blood and yin in relation to other times are lower. And the postmenstrual phase is very interesting. Dr. Xia always stresses that it's a very important time, a very important phase to set a good standard to the menstrual cycle. And I completely agree with him. In my experience, phase 2, the postmenstrual phase, is a very important time to treat, for example, endometriosis, polycystic ovary, and also burn low, i.e. menorrhagia or metrorrhagia. It's very important to treat in that phase. So So there are three characteristics here. The yin is growing, reflecting the follicular development, and the jing is maturing, and that leads to the follicular development and the maturing of the follicle. Yang is decreasing, and also crucially the growth of yin is reflected in the increasing cervical secretion, which occurs in phase 3. And I'm talking about the cervical secretion, a physiological cervical secretion, not a vaginal discharge. In phase 3, ovulation occurs, and yin reaches its maximum, and yang is beginning to increase. And ovulation, from the Chinese gynecology perspective, is under the influence of Du, Ren, and Chong. Is due to the activity of Du, Ren, and Chong. So they need to be stimulated in order to promote ovulation. And the beginning of phase 3, there is an increase in temperature, basal temperature, which is reflected in the rise of yang in this phase. And also the increasing cervical secretion, which we're going to discuss in a moment, which should look like a viscous, stretchy, elastic mucus like egg white. And Dr. Xia attaches great importance to this secretion, and he says it's a direct manifestation of kidney jing. He always, when he treats women for infertility, he always asks them to check for that. And if that is absent, that indicates a kidney deficiency, even in the absence of any kidney symptom. And phase 3 can be compared to phase 1. In phase 1, there was a strong downward movement in the Xiao-Fu area, XIAO. In phase 3, there is a somewhat upward movement in the Xiao-Fu area and the lateral abdomen, which is under the control of the Chu-Mei. And for this reason, she is going up, and the Chu-Mei channel scatters over the breasts. There may be some breast distension and tenderness, and also some feeling of heat from the qi rising. But heart qi needs to descend to induce the discharge of the ovum from the ovaries. And going back to the cervical secretion, that is particularly important for us because whilst the increase in temperature occurs after ovulation, so it's not much use for us for the timing of the treatment, the cervical secretion appears before ovulation. So as soon as the cervical secretion appears, we know that the woman is in phase 3 and that we should use herbs to promote ovulation if we're treating her for infertility. And that is also very useful when the periods are irregular. We don't know exactly where the phases are. And let's say a woman has a period and then phase 2 is very long, maybe 2 or 3 weeks instead of 1 week. As soon as the cervical secretion appears, then we know that phase 3 is starting, and we can tailor the treatment to promoting ovulation if we are treating her for infertility. Strictly speaking, one could distinguish 2 subphases in phase 3, before and after ovulation, but for the purpose of treatment principle, it is actually not necessary to do so. And going back to the decrease and increase of yin and yang, during phase 3, yin is decreasing and yang is increasing, and if there is an excess of yin, that could delay ovulation because the yin is not decreasing. And what does excessive yin mean in practice? Dampness and phlegm in the uterus would be an example of that. And they could delay ovulation, which is exactly what happens in polycystic ovary. Phase 4 is a premenstrual phase before bleeding, before the next bleeding time, and that's very much under the influence of the liver qi and liver blood. Liver qi is moving if there is a free flow of liver qi, and the movement of liver qi moves blood, which together with the descending heart qi induces the next bleeding time. And in phase 4, yang is rising rapidly. It's reaching its maximum. And that's very significant. I always stress this when I give my lectures, that not every premenstrual symptom is due to liver qi stagnation. Not by any means. And in my opinion, liver qi stagnation is overdiagnosed and overemphasized. If you look at that diagram, notice the increase in yang in phase 4. You could have premenstrual symptoms from excess yang, like liver fire or heart fire, from yang increasing too much. Or you could have premenstrual symptoms from yang not increasing because the yin is excessive, in the form of dampness and phlegm in the uterus, which are also cause of premenstrual symptoms. Or you could have some premenstrual symptoms from yang not increasing enough, like spleen and kidney yang deficiency. So not all premenstrual symptoms are due to liver qi stagnation, not by any means. So let's look at the treatment principle in the 4 phases, because that's really the most important thing for us. From the point of view of extraordinary vessels, phase 1 corresponds to the chung mei. So the chung mei is very active in phase 1, and that's what we would treat in phase 1. Phase 2 is the time of the ren mei, and especially kidney yin. Phase 3 is under the influence of the ren and du. I call the du mei the forgotten vessel in gynecology, because it plays an important role, as important as the ren mei, because the ren mei represents the kidney yin and the du mei represents the kidney yang. And without the kidney yang, there wouldn't be a menstrual cycle. And then phase 4 again is under the influence of the chung mei. So the treatment principle in phase 1 is to invigorate blood, and I use the word invigorate in the sense of moving blood, and in the same way Venske uses it. So phase 1 is the best time to invigorate blood or move blood, because the blood is already moving, and it's moving downwards. So if I'm giving a woman a formula to move blood, which in the case of the women's treasure would be stir field of elixir, I would use it in phase 1, but start in phase 4. So I would use it in phase 4 and 1. However, we cannot invigorate blood or move blood if the period is heavy, because that would make it heavier. But if the period is heavy, there are Chinese herbs which simultaneously invigorate blood and stop bleeding, and they're very useful. And 3 of them are listed here: Sanqi, Pu Huang, and Xian Cao Gen. And the remedy, invigorate blood and stem the flow, does exactly what the name says, i.e. it moves blood or invigorates blood and stops bleeding. So it's a very useful remedy to have when the period is heavy, but we want to invigorate blood, which incidentally happens a lot in endometriosis. The period is often heavy. In phase 2 is the best time to nourish blood and tonify the kidneys. So if I was giving a remedy to nourish blood, which in the women's treasures would be precious C, I would use it primarily in phase 2. There is no point in nourishing blood, for example, in phase 1, when the blood is moving down and is being expelled. Not much point in nourishing blood. So if I want to nourish blood and tonify the kidneys, phase 2 is the time that I use it. And as I said earlier, treatment in phase 2 is very, very important. It sets the tone to the menstrual cycle. Phase 3 is also the time to tonify the kidneys, and strengthen Du, Ren, and Chung to promote ovulation. If necessary, this is also the time to resolve dampness, if there is dampness, and tonify the spleen. And lastly, phase 4 is the time to move qi, move blood, and warm the uterus. Why warm the uterus? Dr. Xia says that the rise of yang in phase 4 is very important to eliminate potential yin pathogenic factors like phlegm in the uterus, blood stasis, and cold in the uterus. And as we will see in endometriosis, he advocates actually warming the uterus in phase 4. So, for example, if there was cold in the uterus, that would be the time to treat it in phase 4. With the classical formula would be Wen Jing Tang, the famous formula from the Jingui Yaolue, which in the women's treasures is warm the menses. So here in these next slides are examples of formula for those treatment principles that we mentioned. So invigorate blood in phase 1. The formula is stir field of elixir, which is a variation of Ge Xia Zhu Yu Tang. Or if the period is heavy, very useful formula is invigorate blood and stem the flow. And at the bottom of the slide you have the acupuncture treatment with the Chung Mei, spleen 4 and pericardium 6, open the Chung Mei. And the two important points to invigorate blood are kidney 14, which is a Chung Mei point, and liver 3, which is also a Chung Mei point. The descending branch of the Chung Mei goes to liver 3. So whenever we do liver 3, whenever we use liver 3, we are activating the Chung Mei. And that explains the gynecological use of liver 3 being a Chung Mei point. In phase 2, we nourish blood and tonify the kidneys. And in gynecology, to tonify kidney yang, I use the formula Unicorn Pearl, which is a kidney yang tonic most specific for women and for fertility, for kidney yang, or growing jade for kidney yin, which is also a kidney yin tonic, but also more specific for women and to promote ovulation and fertility. With acupuncture, I would use a Ren Mei, line 7 and kidney 6, plus Ren 4. Those would be the 3 essential points I would use. And kidney 13 is next Ren 4 and tonifies the Chung Mei as well. In phase 3, to tonify the kidneys and promote fertility and ovulation, I would use the same. Unicorn Pearl for kidney yang and growing jade for kidney yin. And the acupuncture points are similar to what we had in phase 2. If there is dampness, I would use the points mentioned there. Stomach 28 is a very important point in the abdomen to move fluids in the lower abdomen. Spleen 9, Ren 9, and bladder 22 in the back. Finally, in phase 4 is the time to move qi, move blood, if necessary, expel cold and resolve phlegm. So to move qi, we use the very well-known, very famous Xia Yao San, which in the women's treasures is Free in the Moon. Free in the Moon is a variation of Xia Yao San, specific for phase 4 symptoms. And as I said, I would use it only in phase 4, not in other phases. For blood stasis, I would use stir field of elixir. For cold in the uterus, warm the menses, which is a variation of Wen Jing Tang. And for damp phlegm in the uterus, clear the palace, which is a very useful formula for damp phlegm in the uterus. And damp phlegm in the uterus is a major pathology, usually in polycystic ovary syndrome. And the treatment with acupuncture is also based on the Chung Mei. Spleen 4 and pericardium 6, kidney 14, liver 3. And this is a summary of the 4 phases. I'm not going to discuss this. It's simply a summary of what I've already discussed. And we need to move on to the treatment of endometriosis. I'm not going to discuss endometriosis from a Western point of view because it's well known to you and it can be found in any gynecology book. I only want to point out a few things which might be useful from the Chinese point of view. Endometriosis consists in the migration of endometrial tissue outside the uterus. So that during menstruation, under the hormonal stimulation, the endometrial tissue outside the uterus is also stimulated, and that produces pain. And the great variety of symptoms is accounted for by the distribution of the endometrial tissue. It can be around the ovaries, the uterine wall, sometimes in the rectum, as you can see here, bladder, ureters, sigmoid colon, etc. It occurs in young women. It's very much a disease of young women. And the etiology of endometriosis from a Western point of view is not really, there are various theories. There isn't one single theory. The first one mentioned here is probably the main one, retrograde menstruation and tubal reflux, i.e. menstrual blood is forced out, goes up instead of down, which is interesting. From the Chinese point of view, that would indicate what? A lack of this downward movement of heart qi and heart blood. And also probably an excessive movement of the liver in going up along the fallopian tubes into the peritoneal cavity. But that's only one of the theories. And you have other theories mentioned here in this slide, and I've actually sent all participants a handout for this lecture. These are the clinical manifestations of endometriosis. As you can see, 97% of women with endometriosis will have painful periods. And also notice 47% have infertility. So endometriosis, together with polycystic ovary, these two together represent a huge proportion of infertility cases. And notice the other symptoms depend on where the endometrial tissue is. Rectal pressure, pain on defecation, pain on intercourse, tender ovaries, etc. These are the clinical manifestations in Europe and especially in England. And the next ones are actually from the American Endometriosis Association, which is slightly different. For example, has low-grade fever, which is not in the previous list. But the dysmenorrhea figures, 96.2, and the infertility figures are the same, and also the pain on intercourse are the same as in the previous list. It's difficult to tell whether endometriosis is more widespread now or whether it's better diagnosed. Who knows how many women, let's say 100 years ago, suffering from very painful periods had endometriosis. We will never know that. So it's difficult to know whether it's more widespread or better diagnosed. And this is the age at which endometriosis presents, and as you can see, it's very much a disease of young women. This is a little teaser question that I have when I give my lectures. Sometimes the endometrial tissue may even be in the nose, in which case there will be nosebleed during the period. So if there was nosebleed during the period, what would this tell us from the Chinese point of view? And the answer is in the next slide. First of all, it would tell us probably that the cause of bleeding is more heat as opposed to chi shu. So it's going up because the bleeding is upwards. It also suggests the presence of the liver fire or a liver pathology going up, or rebellious qi of the liver, or rebellious qi of the chung mei, pathology of rebellious qi, and the need in treatment to subdue rebellious qi, for example with Chuan Yu Shi, which we mentioned earlier. The diagnosis of endometriosis in Western medicine is done with a laparoscopy, which, however, is not necessarily that objective because it depends on the skill of the practitioner at that time. So it's very easy for the surgeon to perform a laparoscopy and miss some locations of the endometriosis. In this picture here, you can see why these cysts are called chocolate cysts. This is an endometrioma, i.e. a cyst, an endometriosis cyst, growing on the ovaries. And it's filled with stagnant blood, very dark blood. And this one is very large, it's 12 centimeters. This is the Western treatment of endometriosis. I'm not going to spend too much time on it. We don't really have time, and it's in your handout. But most of them, with the exception of laser treatment, most of the Western treatments, which are here in this slide, basically are based on stopping ovulation, which from the Chinese point of view doesn't really, or from my point of view, doesn't really make much sense. And rather than discuss each one of these singly, I want to show you a slide which summarizes my view of the side effects of these drugs. And they all have side effects. Some of them cause dampness, some qi stagnation. This slide here, this is my view of the biomedical treatment of endometriosis. One, the contraceptive pill merely masks the problem, doesn't really solve anything. And in my opinion, the contraceptive pill induces blood deficiency. Progesterone derivatives also mask the problem. And interestingly, if you look at the side effects of them, they cause dampness and liver qi stagnation. The Mirena IUD is doubly bad because it has progesterone substances which also cause dampness and liver qi stagnation. But in addition, the IUD itself causes blood stasis, so it's doubly bad. Then there are the GnRH agonists, also mask the problem. And if you look at the side effects, they actually deplete the kidneys and Jing. Danazol was used a lot, is used less now, also stops ovulation. And if you look at the symptoms, it causes dampness or phlegm. And the aromatase inhibitors, which are also used in breast cancer, because they stop the production of estrogen, they cause a kidney deficiency. So as a very important thing, I personally do not combine Chinese herbal treatment with Western hormonal treatment. Not because there are dangerous interactions or any contradiction, not because of that, but because in my opinion there's not much point in trying to regulate the hormones with the Chinese herbs when the woman is taking some drugs that stop ovulation. So it's impossible for the Chinese herbs to work, and that's why I don't combine them, which means that if a woman is taking that, one of those Western drugs, and they come to me, I'll tell them that unfortunately they have to, if they really want to give Chinese medicine a try, they'll have to stop it, and the symptoms will probably be temporarily worse. There's some interesting pictures here on endometriosis lesions, which we're going to look at in a moment. Let's look at the etiology from the Chinese point of view. And first of all, there is intercourse during menstruation. Why would that be a cause of disease? Because during menstruation, blood is going down. With sexual arousal, qi and blood go up. So they cause blood stasis. So it's a cause of blood stasis. Another important cause is early sexual activity, which damages children and may also lead to blood stasis. And that's a definite cause of disease in Western countries. And by early sexual activity, I mean certainly before puberty and certainly during puberty. And I would say early is anything within 2 years of puberty. Excessive physical work, which depletes kidney yang, can lead to can be a factor in the development of endometriosis. And by excessive physical work, I include things like ballet in young girls, running, lifting weights, etc. External cold, a very important cause, because external cold can invade the uterus, and cold in the uterus causes blood stasis. And it's particularly a cause of disease in young girls and teenagers. So the teenagers I've seen with endometriosis, there was nearly always that factor, cold in the uterus causing blood stasis. And tampons and IUDs also are a contributory factor to blood stasis because they tend to block the downward flow of qi and blood. And lastly, of course, emotional strain, very important factor, and can be a variety of emotions that lead to blood stasis: anger, resentment, worry, guilt, and shame. Also fear. Most of them, with the exception of probably sadness and grief. Most emotions can lead to qi stagnation, and from qi stagnation to blood stasis. Now, in order to treat endometriosis, it's very important to decide the Bianping. Bianzheng here means identifying the pattern, which is what we do most of the time, i.e. when we diagnose a patient with liver qi stagnation or heart failure, we are applying Bianzheng, identifying the pattern. But besides identifying the pattern, in China, Chinese gynecology would also always identify the Bianping, i.e. identifying the disease. And if we look at the chapters in a gynecology book, a Chinese gynecology book, painful periods, for example, will be a disease. It's not a disease in a Western sense, but it is in a Chinese sense. So if we look at the old gynecology books, you will not find a chapter called endometriosis. So to which disease does endometriosis correspond? And the answer is, one, certainly painful periods, because as we've seen, 97% of women with endometriosis have painful periods. But all modern Chinese doctors agree on this very important question, that endometriosis also corresponds to abdominal masses, even though they are not palpable masses. And that's a very important principle, which means that in order to treat endometriosis, we must treat it as a form of abdominal mass from blood stasis, and that we must break blood. So the Bianzheng in endometriosis, the pattern is blood stasis. And the Bianping is zhengjia, i.e. abdominal masses, which means that we need to use herbs like these two, Zhu and Sanleng, to break blood. These are kind of stronger than the herbs that invigorate blood. So they break blood and dissolve masses. So the piao, and we can distinguish the piao and the ben in endometriosis. The piao is the manifestation. The piao is blood stasis. The ben, the root, is a kidney deficiency, usually kidney yang, but it could be kidney yin as well. And the temperature chart, in fact, in endometriosis is often flat like that. It's flat in the first half because of the because of the biao, because the blood stasis prevents that from going down. In a normal chart, the temperature should go down here. So it doesn't go down because of the blood stasis. And then it doesn't go up in the second half because of the kidney yang deficiency. And these are tongues which illustrate blood stasis. The first tongue is normal, so why have I included it here? Because although you will always read in the book, when you look at blood stasis, the tongue is purple, but in reality, a purple tongue would indicate the last stage of blood stasis. I have seen very many women with blood stasis and the normal tongue. That simply means that the blood stasis is not severe enough yet to make the tongue purple. So that will be the first stage. I've identified here 4 stages. The second stage would be distended dark sublingual veins, as in this picture. The third would be purple sides, remembering that the sides of the tongue, the liver area, in women also correspond to the uterus. So purple sides, more often than not, indicate blood stasis in the uterus. And finally, the whole tongue is purple. So the piao is blood stasis, and the treatment is to invigorate and break blood. And those 3 herbs are herbs which break blood. There are others which I usually do not use, like shui zhe and tibiechong, the cockroaches. The ben is kidney yang deficiency, which could arise from invasion of cold. Invasion of cold in the uterus obstructs the uterus, and cold is yin and may injure yang. And the third pathology is dampness. Dampness is not always there, but it may be there. And so these are the 3 major pathologies in the order of importance. 1, blood stasis, 2, kidney yang deficiency, 3, dampness. And these are the pictures I was referring to earlier. It's very interesting to look at the pictures because just by looking at these endometrial lesions, it can tell us immediately that it cannot not be blood stasis, and it is blood stasis. If you look at these and the ovarian endometriomas, look how dark this one is, and they're very large. And so it's a very clear indication of blood stasis. And all these endometriosis lesions are all purple. If you look at these in the bottom right hand, reddish purple. And these ones too, they're all purple. Interestingly, if you look at this one on the bottom left hand side, it's kind of bluish purple. So you could argue that's probably due to cold, blood stasis from cold rather than from heat. And this one is also bluish on the top left. So it's a very interesting observation that if you had a surgeon skilled in Chinese medicine, you could make a Chinese diagnosis with the laparoscopy. So the treatment of endometriosis, we need to treat both Ben and Piao. I treat Piao by invigorating and breaking blood, and treat Ben by tonifying the kidneys, usually kidney yang, but it could be kidney yin as well. And if possible, treat according to the 4 phases. And next advice from Dr. Xia is to warm the uterus. Notice what he says, must warm the uterus even if there are no specific signs of cold in order to ensure the growth of yang in phases 3 and 4. Obviously not if there is heat. And this slide here indicates some acupuncture prescriptions to promote ovulation, which are useful to apply before ovulation, when the cervical secretion appears. And going back to the phases, I would treat the band usually in phases 2 and 3, i.e. tonify the kidneys in phases 2 and 3, and invigorate blood and break blood in phases 4 and 1, generally speaking. So rather than discussing individual patterns, which are listed here in this slide, I'm going to discuss combination of patterns. And that's actually one of the weaknesses, in my opinion, of Chinese books. They all list these patterns. And it's all very well to say, liver blood stasis, you do this, you use this, and you do these points. But in reality, in real life, no woman comes to us and she has only got liver blood stasis and nothing else. Or no woman comes to us and she's only got stampede in the uterus and nothing else. There's always a combination of patterns, and especially a combination of a full pattern, example, damp phlegm in the uterus, with a deficiency, so one of the last three. So that is what we're going to discuss as an example. Before doing that, I want to point out the remedy for endometriosis is harmonizing the moon. Harmonizing the moon is a variation of Ouija fooling one, which is for abdominal masses from blood stasis. And I have changed with the addition of more herbs to break blood, the ones in red here. So harmonizing the moon is a remedy that invigorates blood and breaks blood. And it has one or two kidney tonics, but its main action is not to tonify. It's treating primarily the piao, the blood stasis. So let's look at some common combinations. And this is probably the most common one. Blood stasis, kidney yang deficiency, and dampness, in that order. And that's, you can see when you have these combinations of patterns, how useful treating according to the phases is. So in this example, in phases 1 and 4, if you notice in phases 1 and 4, we're using harmonizing the moon, i.e. treating the piao, i.e. invigorating blood and breaking blood in phases 4 and 1, and tonifying the kidneys, kidney yang, in phases 2 and 3 with unicorn pearl. With regard to dampness, I would probably treat it just with acupuncture to reduce the number of remedies that one uses. And this is a very common example of combination of patterns. And this is an example of how you treat it according to the phases. And this is another example, cold in the uterus leading to blood stasis with kidney yang deficiency and dampness. So this is similar to the previous one, except that blood stasis is deriving from cold in the uterus. And this explains what I would use. So I would use harmonizing the moon in phase 1 to invigorate blood and break blood. And in phase 4, I would use warm the menses to warm the uterus. And tonify kidney yang in phases 2 and 3. So this is two very good examples of how useful it is to give the treatment according to the phases. And also the essence of it is also that by treating according to the phases, we're following the natural physiology of the woman. So the remedy will work better. By using the method of invigorating blood during phase 1 and 4, when blood is already moving, it will work better. There will be no point, not much point, in invigorating blood in phase 2, when the blood is at its minimum. And the other examples are just the same. They're just variations of what we've discussed. The principle is the same. Here, for example, there is damp phlegm in addition to blood stasis, there is then phlegm. So we are using harmonizing the moon in phases 1 and 4, tonifying the kidneys with unicorn pearl in phase 2, and we are resolving phlegm in the uterus with clear the palace. And the rest, I'm not going to discuss the rest of this presentation. There are articles from Chinese journals, which you should have received with your handout. And this presentation, as I said, is being recorded and will be on my online website, which is www.maciociaonline.com. www.maciociaonline.com.
Can you unmute her and see if she has a question? Because she hasn't answered. She hasn't asked any questions, but her hand is raised.
Yeah. Okay, I think this concludes the presentation. And I'm just going to check here to see if there are any questions.
Did you hit escape? Maybe. Yeah. There you go. Attendee list. Scroll all the way down.
Okay, I can see there is a hand raised from Solara, and I have unmuted you. Can you hear me?
I can. Can you hear me?
Yes, yes.
You answered the question. I was wanting to know the formula in phase 1 in the very beginning.
Mm-hmm.
But I'd like to thank you so much for this.
Thank you.
And please send us a direct link to your website and how we can order from your company.
Yes, thank you. I will do that. Thanks. Thank you very much, Solara. And I don't see anyone else who had a hand raised. So if you have any questions, you can raise your hand, and I can see who's raising their hand, and I can unmute you. Okay. All right. I think we can stop here, and I'll let you know when there will be a new one, and I will send you the details about the website. Thank you very much, everyone, and have a good day.
Thank you, everyone, for attending. It was great to have you part of our lecture today. Please visit Giovanni at www.giovannimaciocia.com. He has some other courses you can take for CEU courses also, get some credit for your ongoing certifications. So please check those out. Those are also very useful tools. Have a great Saturday, and we'll talk to you soon.
I've done that.
Will you stop recording?
Yeah,